Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. My guest today is Wendy Powell from MUTU. Wendy, thanks for joining me in the studio.
Thanks for having me.
It was very exciting to get to learn about what you're building. We had our first conversation when you joined Startup Health, but let's just introduce to our audience what MUTU is.
Absolutely, yeah. So MUTU System is rehabilitation and recovery for pelvic floor, for core, for abs, postpartum. So we serve women at any stage of motherhood. It's never too late, so new moms right through to not so new moms, dealing with all sorts of pelvic health issues, abdominal core issues.
Okay. How did you get into this?
I got into it because of my own experience.
Okay.
So my history was I used to be a pre- and postnatal personal trainer.
Okay.
And around, my babies are 15 and 17 now,
Okay.
but when I had my
Impossible,
first...
but go on.
When I had my first one, Ava, I had very healthy pregnancy. I was training right through my pregnancy, but very traumatic birth. And then my son is only 18 months after that. Same thing happened again. And even though I was a highly certified personal trainer specializing in postpartum, I was like, I know this stuff. I should know what I'm doing. But I didn't have the tools I needed. What I had been taught to teach wasn't adequate. And so through my own recovery and then searching for answers, really, because fitness, my industry at the time, didn't seem to know what to do. It had certain strategies and techniques, and they weren't working. And I saw them not working for my clients, and they hadn't worked for me. So I kind of took my study outside of that industry, and I started working with biomechanics,
Okay.
with sex therapists, with midwives, with physiotherapists, medical professionals dealing with this bit of the body. That fitness,
below the belt health.
Exactly.
One person told me yesterday. Yeah.
That's a great phrase, yeah. And it's an area of the body that most of fitness industry doesn't really understand. They don't really know what to do with it, apart from tell people to do ab exercises, and that's not enough. So, yeah.
Interesting. You said something that registered with me, because I've talked to a lot of founders who said, even though I had this background, even I didn't have the access.
Yes.
And it really opens up this conversation about lack of access for folks. So maybe talk to me about that, about kind of who is able to reach a specialist and just who's being left out in the cold.
Absolutely. So the postpartum period is a time when women just do not, it's lack of information as well as access. People just don't know. I mean, we had there was a story in our community just this week of a young woman. She was in her early 30s, recently had her second baby. She'd been told she had a prolapse. She was terrified. She had no information about that. She felt physically and emotionally broken. And just that lack of information about what happens to our bodies. We're not really, I think a phrase I hear so often is, I wish I'd known. I wish I'd known what this was going to feel like, what this was going to be like, because the information just isn't there.
Okay. Tell us a little bit about the trajectory of the company. How long has it been around? Kind of where are you at now?
Sure. So it's about as old as my daughter, because because that's where it came from. So we've been an online digital platform for about 10 years now. Okay. It's a bootstrap company. We're a small team. We've served more than 100,000 women over that time, and it's evolved. The first program for MUTU was as things do. So the original MUTU. I strapped a flip camera, which don't exist anymore, I don't think, strapped a flip camera to a tree in my back garden and filmed myself doing exercises. So that was the first iteration. Yeah. It's a lot more sophisticated now. We've been through various...
That means you're basically a pioneer in this industry. I mean, you've been seeing it through the evolution. And when did you see an inflection point?
In the business?
Yeah.
So, with regards to the pioneer, somebody kindly said I was doing femtech before femtech was a thing, but
a little bit.
Yeah. So the inflection was a few years in. I was blogging. I was writing a lot online into the ether. Instagram wasn't around then, so Twitter was kind of where we made connections. And the way I did that in the early days was very much stalking medical health professionals who were specialists. So that's pelvic health physiotherapists and physical therapists, women's health physiotherapists around the world. I just found them on Twitter and I sent them my stuff. And I was like, is this safe? Would you give this to your patients? Does this work? What would you change? And so from the very start, I really sought that medical approval, if you like, and that validation and that check-in that this was right, because these are intimate areas of our bodies. They're intimate issues. They carry sadly a lot of shame and embarrassment for a lot of women. So it needed to be right. And so I did that from the very start, that kind of really connecting with the medical profession in this specialist area. And it was really that saw the difference, because people started coming to me and saying, oh, my midwife sent me, my OBGYN sent me, my physio sent me. Yeah.
Very interesting.
Yeah.
So born in the UK, correct?
Yes.
And are you in the United States as well?
Absolutely. From the beginning, those first customers were actually from the States.
Okay.
So it's quite consistently really over the last decade that around kind of 65% of our customer base, our membership base, is actually US based.
Okay. And kind of what are those expansion plans?
So the expansion plans are really around new routes and getting to more people. The bottom line is that a direct-to-consumer model like MUTU System has great advantage in the sense that we get real world evidence, we get real social proof, we really know that we have an absolute fit. But with anything direct to consumer, by definition, is of course only available to those that can afford it and that those have that access and that information. So what we're looking at now is talking to medical providers. We're already involved with the NHS in the UK, so talking to other medical providers and employers to basically increase that access and that impact.
Got it. What are you most excited about for the next 12 months?
So for the next 12 months, we've got some exciting new trials happening with the NHS in the UK, so that's great. There's going to be more happening there. And we've also just started a partnership with a big European corporate where we're doing, there was a pitch competition last year that I won, and they've invested £200,000 into the business and into promoting particularly around incontinence products, so that's sort of their area. So we're doing I'm excited about a lot of coverage that we're going to be doing with that around the partnership between a corporate that creates and manufactures incontinence products with a program that actually improves the situation. So it's kind of a whole approach.
So you've been in this for a minute.
Yes.
How have you seen the conversation change? How have you seen the culture change around pelvic health? You're talking about incontinence, just these industries. I'd like to think we're talking about them more now than we were 10 years ago, but how have you seen it change?
It's definitely changed, and there is a lot more conversation. What has been interesting as well, the conversation for me, my view is that sometimes it doesn't go far enough, because what I mean by that is you'll see, maybe on a daytime show or something aimed at women, you'll see conversation around incontinence, mild incontinence for moms. And it's laughed about. It's like, oh yeah, I'm not going to go on a trampoline and I can't sneeze or I can't laugh too hard. And so for me, I love that the conversation is more out there, so people are more willing to share that. And there's a huge amount of value in that validation that you're not alone. That's important.
Huge.
But for me, it doesn't go far enough, because it's like, you can do something about that. You can fix that. So there is a lot more conversation. There's still a long way to go. These are issues that carry too much shame and embarrassment for women, and they're so common. I mean, 50% of women who have had a baby at some point in their lives will have some level of prolapse symptoms. Half of them, and nobody's talking about it. So
that's just the women. I mean, there's the husbands who care about their wives who are struggling.
Absolutely.
And want the best for them as well. So it's a huge conversation.
Yes,
it needs
it
to be
is.
had. I love the work that you're doing, Wendy. Thanks
you.
for taking the time with me today, and I hope it's an amazing 2023.
Thank you so much.
All right. Take care.